All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the discussion today is very interesting. It is the effect of the peripheral inflammation, that means inflammation inside the body, on the cognition in the brain or on the brain tissue. So why is this topic interesting? The interesting part of this topic is usually the dementia, and I would talk about the dementia definition soon. Usually the dementia or the brain tissue damage occurs because of the inflammation in the brain or the incorrectly produced proteins, which then cause inflammation in the brain. However, we are talking about the inflammation, for example, infections in the body or other autoimmune diseases that cause inflammation in the body, not the brain. It is the effect of these inflammations that also leads to dementia, which means clinically it is important for us to control our inflammation. So if we are trying to be hardy to say, you know what, I'm going to go through the pain, I'm going to suffer through the disease, I don't want to take controlling substances, that can become a problem because the inflammatory cytokines that are being produced, the inflammatory molecules that are being produced in the body are going to go cross the blood-brain barrier, get into the brain, activate the brain's immune system, which in turn will start damaging the brain tissue. The brain immune system, once it is activated, it doesn't know that there is damage in the brain or not. All it knows is I have become activated. Microglia of the brain or macrophage-like cells of the brain, the innate arm of the immune system of the brain, is the primary cell or the cells that take part in this kind of a damage. So the signals come from the body and they become active in the brain and start damaging the brain tissue. So that is the basic topic. Of course, clinically, the point to remember is that please keep your inflammation under control whichever way you feel right. Food, lifestyle, allopathic medicine, non-allopathic medicine, whatever helps you, discuss with your doctors and make sure that your peripheral or systemic inflammation is under control. So with this, let's look at some of these drawings and topic. So first of all, what is the definition of dementia? According to the Alzheimer's organization, dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia. The cells to keep in mind while we are looking at various studies today are microglia. Microglia, as the name is saying, micro means small, glia means glue. These are small glue-like cells of the brain. Brain has a number of glue-like cells which are called collectively as neuroglia. For example, astrocytes are part of the neuroglia. Ependymal cells are part of the neuroglia. Similarly, microglia or these macrophage-like cells or the immune system-like cells are actually part of the neuroglia. Microglia are macrophage-like cells. They are the brain's immune system. They are the brain's defense system cells. And once these cells become activated, they do a lot of things. For example, they do phagocytosis. They can move from one area in the brain to another area by amoeboid movement. They can help regulate various ionic concentrations. They would kill the neurons. And not only they can kill the neurons, imagine this is a neuron that has multiple branches that are going and connecting with other neurons. Microglia they can cause synaptic stripping. What that means is that they will cut various neuronal branches to disconnect a neuron from other neurons in their thinking that these neurons are connected in the injured area. So they're kind of snipping away those neuronal connections so that the injury does not spread too much. Of course, a neuron whose branches are being cut may end up dying. The basic idea is that if you cut the branches of a neuron, then the neuron would develop new branches and would develop new synapses, and the area of the injury would recover, or there will be new connections formed. This is part of the plasticity. But the problem is there is no injury in the brain. The microglia became activated because of the signals coming from the body. So the snipping they are doing is unnecessary and damaging. The neuronal death they are causing is of course damaging, and that is what would lead to the dementia. So once again, I would say it like 20 times today. Once again, the important thing to keep in mind is to keep these systemic inflammations at bay, controlled, so that the brain tissue damage is minimized. So now let's look at some of the references in these studies. So this is drbeen.com. If you would like more medical lectures, become a member there. Plus, if you are a member there, we do a Zoom call every Tuesday where we discuss various topics, and then we record them and we make them into videos. Then let's continue. So this is the definition of dementia. I've already discussed it with you. This is a very good article. This is about microglia. So here they talk about what are microglia, what is their origin, what are the types of microglia: activated, reactive, amoebic, phagocytic, etc. So interesting topic to discuss. All of these links are in the description of this video as well. This is Wikipedia, microglia. I went over this, good information here, not much of a problem. So here are the studies. So this is the first one. This is printed in Neurology 2019, March. Systemic inflammation during midlife and cognitive change over 20 years. So people who have systemic inflammation in the middle of their life, what happens 20 years later to them? So let's see. Objective: to examine the association between systemic inflammation measured during midlife and 20-year cognitive decline. Method: within the atherosclerosis risk in communities cohort study, inflammatory biomarkers were measured during middle adulthood. We created an inflammation composite score using 4 blood biomarkers. So note down these biomarkers. These are fibrinogen, white blood cell counts, von Willebrand factor, and factor VIII. They also measured C-reactive protein at a second visit. C-reactive protein is a protein that is released when there is acute inflammation going on. Cognition was assessed over 3 visits spanning 20 years using measures of memory, executive function, and language. So what did they see? They saw over 20 years a milder or small change, but change towards the dementia. They saw with the C-reactive protein, they saw larger change. So acute inflammations or inflammatory states actually affected the brain's cognitive scores. So here a total of 12,336 participants were included. So baseline age was 56.8 years, 21% Black, 56% women. After adjusting for demographic variables, vascular risk factors, and comorbidities, each standard deviation increase in midlife inflammation composite score was associated with an additional 20-year decline of minus 0.035 standard deviations in the cognitive composite score. So they have this over here, but I want to read this here. CRP, C-reactive protein, which is a measure of the acute inflammation happening in the body, C-reactive protein in the top quartile was associated with an 11.6% steeper cognitive decline. 11.6% steeper cognitive decline. In cognitive domain-specific analysis, elevated midlife inflammatory markers were most consistently associated with declines in memory. So this is one study. Then look at this one. Comorbidity and systemic inflammation as drivers of cognitive decline. New experimental models adopting a broader paradigm in dementia research. This is such a beautiful article, very long article. I'm not going to go over all of this, but I'm going to give you some hints from here. First of all, they say that dementia prevalence increases with age, and Alzheimer's disease accounts for up to 75% of the cases. Then they say Systemic inflammation has been a strong common theme in these approaches, the approaches towards the understanding of dementia and neurodegenerative problems. We hypothesize and discuss in this review that a disproportionate inflammatory response to infection, injury, or chronic peripheral diseases is a key determinant of cognitive decline. One part that they would say, and I'm kind of eager to put that in front of you, so I will not wait to go scroll down and read it. I'm going to present it to you right now. They say that it was interesting that it is thought that people with rheumatoid arthritis develop less Alzheimer's disease or dementia. And so it was thought that rheumatoid arthritis is actually protective. And they say that the basic protection is not the rheumatoid arthritis as an inflammatory disease, but instead because these patients are on anti-inflammatory drugs, which continue to control the inflammation in the system, leading to lesser cytokines and inflammatory signals going to brain, leading to lesser dementia and Alzheimer's disease. What an interesting finding. So they talk about, we propose that detailed study of alternative models which encompass acute and chronic systemic inflammatory comorbidities is an important priority for the field, and we examine the cognitive consequences of several of these alternative experimental approaches. What they're saying is that to understand dementia and Alzheimer's disease, we should not just keep looking inside the brain and tau proteins and how are they coming together and how do we get them out. We should also look at the peripheral inflammations and see what is the role of those inflammations which is contributing or which is leading to dementia. So experimental models of severe sepsis is inflammation, infection in the body tissues and fluids. Experimental models of severe sepsis in normal animals or moderate acute systemic inflammation in animals with existing neurodegenerative pathology have uncovered roles for inflammatory mediators interleukin-1 beta, tumor necrosis factor alpha, inducible nitric oxide synthase, that is an enzyme, INOS we call it, complements are the proteins coming from liver that take part in the acute inflammation, prostaglandins, and NADPH oxidase in inflammation-induced cognitive dysfunction and neuronal death. So they keep going and they keep discussing these. What is important for me was to present to you the interleukin, tumor necrosis factor alpha, INOS. We can get those measured for ourselves to see where do we stand. So here, individuals taking non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen-like things, during middle age are significantly protected from subsequent development of Alzheimer's disease, like people having rheumatoid arthritis. And it may be instructive to recall that these medications were taken to treat peripheral inflammatory conditions like rheumatoid arthritis. Isn't that interesting? So now I'm just going to go over some of the areas that they have covered. Lipopolysaccharides. Lipopolysaccharides are from bacteria. So these are bacteria's toxins. And they talk about how lipopolysaccharides would cause inflammation, which then would send signals to the brain, and the dementia would increase in these patients who have lipopolysaccharide or infections. Then they talk about delirium and postoperative cognitive dysfunction. So they're saying delirium might be regarded as the clearest evidence that systemic inflammation impacts negatively on the degenerating brain. Then they talk about, for example, arthritis. This is fun to read. Epidemiological studies showing that RA patients were protected against the subsequent development of AD led some to suggest that arthritis may actually protect against AD. More recently, a population-based study identified RA as an important risk factor for subsequent dementia generally or AD specifically. And look at the risk, 2.77 times or 2.45 times. Therefore, it is likely that RA patients taking an take anti-inflammatory treatments for their condition, which in turn protect against the development of AD. Anti-tumor necrosis factor therapies are an effective treatment for RA. And recent conference proceedings from the American College of Rheumatology have reported that they significantly reduce the risk of development of AD. So keep in mind when you're reading this or you're looking at this or watching this, this systemic inflammation would generate these tumor necrosis factor, interleukin-1 beta, C-reactive protein, and other inflammatory biomarkers. Those markers can cross the blood-brain barrier and go and activate the microglial cells. Microglial cells, once they become reactive, they would start just willy-nilly pick up the brain tissue and start causing death of that tissue or start snipping it, phagocytosing it, and cause damage and inflammation, which would then, of course, lead towards dementia and Alzheimer's disease. So here then metabolic syndrome. So metabolic syndrome, one of these three things: abdominal obesity, hypertension, hyperglycemia, hypertriglyceridemia, and low levels of high-density lipoprotein. Any three of these are called metabolic syndrome. Metabolic syndrome is a significant risk factor for development of Alzheimer's disease, but this association was limited to those metabolic syndromes cases with elevated serum pro-inflammatory markers. So not everybody with the metabolic syndrome had the problem. Those who had the metabolic syndrome and severe enough that they also developed inflammation then also had higher incidence of dementia, indicating that inflammatory processes associated with or even underpinning metabolic syndrome may contribute to dementia progression. Then atherosclerosis. And they talk about atherosclerosis, inflammatory condition, interleukin-1 beta, NLRP3 inflammasomes. And by the way, these NLRP3, TLR pathways, I have already done them. If you go to Drbeen and go to courses and then go down to inflammation, you would see that I've done the major inflammatory pathways: omegas, key inflammatory pathways, TLR and NLRP pathways, cell stressors, NFK beta, MAP kinase, JAK-STAT, arachidonic acid, hypoxia-inducible factor, and other PI3K pathways, etc. So I've already covered them here. You can actually go and watch them. I think you would love them. So the interleukin-1 beta via the NLRP3 inflammasomes, this leads to a state of chronic vascular and systemic inflammation. We're talking about atherosclerosis. We know that there is vascular inflammation, and of course the vascular inflammation is occurring because there is an inflammatory state, and then the systemic inflammation is also present. So the acute reactant C-reactive protein, as I said before, C-reactive protein is produced by the liver in response to the inflammatory signals, is most readily measurable, and it has been shown that high levels of it are associated with increased, look at this, microglial activation in human positron emission topography imaging studies. What else do we need to know to make sure, one, we are inflamed less, so eat or expose yourself less to the things that cause inflammation, and number two, make sure that the inflammation is controlled. And that also means make sure that you measure your C-reactive proteins over time and see what kind of trends do you have. High sensitivity C-reactive protein can be measured, interleukin-1 beta can be measured, tumor necrosis factor alpha can be measured, VEGF or vascular endothelial growth factors can be measured, LDL can be measured, lipoprotein LP little a can be measured. So these things are very important to understand what is the body state. And then you can decide how to manage it, meaning with your doctor's help. Now, obesity and type 2 diabetes. So again, if you see here, tumor necrosis factor alpha, interleukin-1 beta, interleukin-6, CCL2, and adipokines like leptin are part of the obese individual's inflammatory state. And consumption of high-fat diet in normal mice increases hippocampal pro-inflammatory markers, IBA1, tumor necrosis factor alpha, and glial fibrillatory acidic protein, reduces brain-derived neuropathic factor and dendritic complexity, and decreases long-term potentiation, learning ability, and impaired working and spatial memory. Point is, this is another inflammatory state, and then that also reflects to the brain. Insulin resistance in this model also chronically elevates corticosterone, which, like chronic stress, contributes to microglial priming, increases brain interleukin-1 and tumor necrosis factor response. So insulin resistance actually causes microglia to stay active because the stress hormone corticosteroids are produced. So microglia are just sitting there waiting, they're primed. They want some signal for them to become active. And as soon as there is any signal coming from the body, which is of type interleukin-1 and tumor necrosis factor, they would jump into action, and there we have a damage. Use of glucagon-like peptide 1, that is kind of the opposite to the insulin, which stimulates insulin, can reverse deleterious effects of high-fat diet on learning and memory. CA1, long-term potentiation, and hippocampal glial fibrillary acidic protein, mammalian target of rapamycin, mTOR, and vascular endothelial growth factor, and this is now a promising therapeutic target for AD. In summary, what they're saying is that things that would help reduce the insulin resistance and help improve the insulin levels would actually help reduce inflammation and so reduce the dementia risk. So then they talk about, is mild systemic inflammation enough? The subclinical inflammation, which just slow, inflammation without even much clinical symptoms, is that sufficient to cause dementia? An excellent study of the impact of low-grade inflammation on brain aging was performed using parabiosis. So in parabiosis, what they do is they take an older mouse and they take a younger mouse or animal, and they fuse them together, and they fuse their blood vascular system. So now the younger mouse's blood is going to the older one, older mouse blood is going to the younger one. And they found that the older mouse, which did not have any pathology, it was just old. That means it had heightened inflammatory state without any other pathologies. That actually started affecting the younger mice's brain activity. In turn, the fresher, less inflamed blood from the younger mouse, when that went into the older mouse, that started helping reverse the older mouse's brain dementias, which proved two things. Number one, as we age, our inflammatory state continues to go up, which causes then dementia-like outcomes. Number two, if we try to improve the situation, the dementia risk or dementia score continues to improve as well. So there is a chance to improve it. So an excellent study of the impact of low-grade inflammation on brain aging was performed using parabiosis, in which aged and young animals are sutured together at the flanks and ultimately share the same circulation. This demonstrated that the exposure to the bloodstream of the aged mouse brought about impaired neurogenesis. Neurogenesis is neuron development, neuron production. Impaired neurogenesis, electrophysiological evidence of impaired memory function, and cognitive impairment in the young animals. And remember, as I just said, the older animals did not have a disease. They were just old. Interestingly, the opposite was true for old mice exposed to the young bloodstream. Some recovery is possible when exposed to the young bloodstream. So what does that mean? Should we go out and start having young blood? What we should do is control our inflammation and control the factors that cause glycation-like behaviors, which would then in turn cause inflammation. Fried foods, no. Reduce carbohydrates or carbohydrates with low glycemic index, etc. Less glycation, more inflammation control. So then they talk about the authors identified a number of inflammatory factors present in the blood of aged rodents and people, and demonstrated that one of these factors, the chemokine eotaxin CCL11, was capable of producing the same deficit as exposure to blood from aged rodents. And remember, a few days ago, I did this talk about the CCL11 and how controlling that reduces inflammation and reduces aging process. These animals had no specific disease state, and simply the elevated inflammatory state of aging was sufficient to bring about some cognitive decline. And so this article continues. I want to now present the last study and then we wrap up. So this is a study, Systemic Inflammation and Disease Progression in Alzheimer's Disease. Acute and chronic systemic. Once again, whenever I'm saying systemic inflammation, that is the inflammation outside of the brain, in the body, which is then affecting the brain. Acute and chronic systemic inflammation are characterized by the systemic production of pro-inflammatory cytokine tumor necrosis factor alpha that plays a role in immune to brain communication. Previous preclinical research shows that acute systemic inflammation contributes to an exacerbation of neurodegeneration by activation of primed microglial cells. So check this out. I'm going to bring us to the results. Acute systemic inflammatory events found in around half of all subjects were associated with an increase in the serum level of pro-inflammatory cytokine tumor necrosis factor alpha and a twofold increase in the rate of cognitive decline over a 6-month period. Alzheimer's disease patients, two groups, one group had infections, and within 6 months of the infections, they had further decline in their Alzheimer's disease or in their cognition. The other group did not have infections and did not have that rapid decline. They were also in Alzheimer's disease. High baseline levels of tumor necrosis factor alpha were associated with a 4-fold increase in the rate of cognitive decline. So if somebody already had a high baseline tumor necrosis factor alpha, that means they were already more inflamed. Then they developed infections or some inflammation as well. Then the rate of decline was 4 times faster. Subjects who had low levels of serum tumor necrosis factor alpha throughout the study showed no cognitive decline over the 6-month period. Controlled inflammation or no inflammation, no cognitive decline in 6 months' time. Conclusion, both acute and chronic systemic inflammation associated with increase in serum tumor necrosis factor alpha is associated with an increase in cognitive decline in Alzheimer's disease. So these are the studies that I wanted to discuss or present to you. Once again, as we age, we start becoming more and more inflamed. There are many factors. I've been actually covering some of those factors: fried foods, aged products, glycations, many other reasons that we do not trigger our autophagy. Result is we are inflamed. That inflammation then causes contribution to dementia. So controlling the inflammation is very important. Having a lifestyle, food style, if possible, is very important to keep inflammation low. And I say if possible because it is easy for me to sit down here and say have a better lifestyle. But imagine if you live in a polluted city. How can you just switch off the pollution? You cannot. Or imagine if you are under stress for, let's say, financial reasons or for social reasons, family reasons. How can I just say have a better lifestyle and you would just switch off those stresses? So whatever can be controlled, at least we should have a focus and we should be aware that this decline in cognition can occur because of inflammatory state. If we cannot control the inflammation from occurring, then at least control the inflammation from continuing by taking anti-inflammatories, whatever way you can. I have done tons of videos about that. So with this, thank you very much. Like, subscribe, and share. There are links in the description if you would like to support this work. And the best is to become part of Drbeen and enjoy another 800-900 lectures over there as well, and free Zoom talks as well. Thank you very much. Talk to you later.